Don't always be looking at the side of the women. Male factor infertilities are becoming more. Men are contributing more to difficulties with getting pregnant.
There is this fear from ladies whenever they notice there is a discharge from the breast. You hear that, would I be able to get pregnant? Oh, the reason why I'm not getting pregnant is because I'm having discharge from the breast. Is there any relationship between milk coming out of the breast and the inability to get pregnant?
Oh, okay. All right. Inability to get pregnant um, could be precipitated by several factors. There are many factors that could probably make or cause a delay or, affect the chances, of a woman getting pregnant. We have some female factors, we have male factors, you know. But sometimes the downside of breast milk discharge is that it may affect it may affect the regularity of ovulation of some of these females, and then causes what we call anovulatory circles. Circles are the woman don't ovulate, and of course that will lead to what? Circles that the woman don't ovulate, you definitely not be able to get pregnant. So it can be a contributor to anovulatory infertility. That is why when we usually advise that if you notice you're having discharges from the breast, it's not something that you just, you know, which way like that. You have to see come into it, particularly when you are desirous, you are married, you are desirous to get pregnant. You need to come to the doctor, see your gynecologist for proper review. The focus is not just on the breast milk. If a woman is having difficulty with getting pregnant, and you are seeing a gynecologist, the gynecologist will not focus alone on just that breast milk discharge. Of course, it can be a contributor. It may just be one of the easiest things for your doctor to actually manage. But it can also coexist with other factors. Who tell you that you know you having breast milk discharge, you're not having a partner with abnormal semen parameters, with poor semen. They could coexist together. A lady may have breast milk discharge and have bilateral tuber blockage. So which is worse? Is it just the breast milk discharge or the tuber blockage? So irrespective, irrespective, if a lady had been trying for a period of at least 1 year and is still not able to get pregnant, it shouldn't just be tied to the breast milk discharge that the lady is probably having. It's always important to look at all other factors, both the male factors and then those female factors that are associated with it. There are many factors. Check for factors that may be responsible for anovulation, do the hormonal profile, check the prolactin level. Outside that, there are certain tests you do to assess the patency of the tube to be sure that the tubes are open. You are doing your pelvic scans and other scans to be sure that there are no coexisting masses, no coexisting fibroid, and then many other things you may need to do. You may then do some ovulation to check the ovarian result depending on the age of these women. And then don't forget to investigate the male. Don't always be looking at the side of the women. Male factor infertilities are becoming more. Men are contributing more to difficulties with getting pregnant. Men are contributing more currently. Men are exposed to so many risks currently. And, there are some few studies that are currently available that many men, if you go to fertility clinics, where you have infertile couples coming into the clinic for, evaluation to check for the cause of their inability to get pregnant, you see that a couple of them, close to 40% of the men, have some form of sperm abnormality. we have to take it very seriously and not always looking at the side or the part of the women in that aspect. That being said, the galactoria, the breast milk discharge, could be a cause of anovulatory infertility. And if there are no underlying pathology, it can actually not be too difficult to manage.